Welcome back. Cancer treatment breakthroughs are advancing swiftly, offering hope for many late stage cancer patients or those whom conventional treatments have failed. However, the accessibility of cancer clinical trials is hindered by the financial strain of travel, particularly for those with limited means. Joining us now to discuss more is the CEO and founder of Lazarex, Donna Dornsife. Donna, thank you so much for joining us today.
Thank you so much, Brittany.
So, can you share more with our viewers about the Lazarex Cancer Foundation and its mission to improve access to FDA clinical trials?
Absolutely. I started Lazarex in 2006 as a result of a personal um, family situation with cancer and came to know firsthand the barriers around navigating through clinical trial options. And then we were faced with having to constantly reach into our pocket to cover the out of pocket expenses for travel to get my brother in law to his clinical trial. And I just really felt that that was fundamentally wrong and that we needed to do something so that everyone could have access, equitable access to breakthroughs in clinical trials.
And so, clinical trials can be used as an alternative if the traditional methods of treatment aren't working. Can you explain to our viewers what exactly a clinical trial is?
Certainly, everything that we have available to us today in the form of, treatment or medicine has gone through and been approved, has gone through clinical trials and has been approved by the FDA. It's tested for safety and effectiveness. And so, for cancer patients for whom standard of care has failed or what's currently available on the market for treatment, when that doesn't work, patients have to find an alternative, or else, unfortunately, cancer will probably win. So that means that clinical trials are literally a lifeline for our patients.
Yeah, and speaking of late stage cancer diagnoses have increased, especially post COVID, because people weren't able to make their appointments due to COVID restrictions. So, in your experience, can you talk a little bit about how clinical trials have improved outcomes for patients, maybe more in the late stage?
Certainly, we have many patients who are with us today because they participated in a clinical trial. Um, you know, Cancer is a tough journey, and unfortunately, we don't win all of the time, but we win much of the time. And, that could look like a better quality of life, extension of life. We have patients who've been alive for years because they've participated in trials. And we have many patients who've actually achieved remission and who are living life cancer free. So, it's a wonderful way to take advantage of the latest and greatest that research has to offer.
Yeah, absolutely. And at the top of the interview, you mentioned you had a personal connection that kind of sparked Lazarex. So, if possible, can you talk a little bit more about that experience and how it influenced your commitment to the mission of Lazarex?
Absolutely. We unfortunately lost my brother in law, but during the course of his treatment, I came to know a lot of people who needed similar assistance. And that's how Lazarex was founded. And to this day, 18 years later, we're still the only organization who offers a complete, and holistic approach to connecting patients to trials and then providing financial assistance to them. And this is really critically important for individuals who are disproportionately impacted by cancer. And unfortunately, right now, that is a lot of our communities of color. And so, it's really important to our organization that we remove barriers and create equitable access to cancer clinical trials and improve the diversity of participants.
Yeah, and while clinical trials can be crucial and can be life saving, like in the experience with your brother in law, they're unfortunately not always accessible. So, can you discuss what are some of the barriers that prevent people from being able to take part in clinical trials that we may not know about?
Certainly. So the first thing is knowledge, right? If you don't know about a clinical trial, you'll never be able to consider even participating. And unfortunately, in many instances, clinical trials are just not brought up by an oncologist or a treating physician. So, part of our mission is to break down the knowledge barrier and help
Hmm.
people understand what clinical trials are so they can consider participating. Then you have the financial toxicity of cancer and, patients making decisions about do they want to participate in a trial based on their bank account, versus really what's best for them and their health. Having to leave your support network and go, travel far away to participate in a trial because unfortunately trials are typically not in your own backyard. And then
Hmm.
we have a lot of, cultural and historic barriers that are created for our communities of color, a lack of trust, for, very legitimate reasons. And so it makes it even a little bit harder sometimes for community members to who come from communities of color to trust the system and to want to participate. And so we work really hard to, in a culturally appropriate way, to overcome those barriers as well.
Absolutely. And can you talk a little bit, while you discuss breaking down barriers, can you talk about some of the ways that Lazarex helps do this? Is it through networking, through fundraising? What is it through?
So we are a public charity and we absolutely depend on public support in order to do what we do. Our ability to help patients is directly related to the amount of funding that we can raise,
Hmm.
during the course of the year. Um, And a lot of our programs are oriented to clinical trial navigation and supporting patients in trials. But we really feel that there's a lot more that we can do. So we have another program called the Cancer Wellness Hub. And the Lazarex Cancer Wellness Hub takes place in underserved communities of color to start at the beginning of the cancer journey or even before. You may be diagnosed with cancer. So, the best gift that we can give someone is to not get cancer at all, right?
Yeah.
So we start engaging early and talk about, the importance of screenings and, early stage diagnosis and the decisions people can make to perhaps, avoid cancer, have a healthier lifestyle. Um, if someone needs a screening and, they're diagnosed with cancer, then we help them understand what the treatment pathway looks like and ultimately help them navigate through clinical trials if that becomes necessary.
Hmm. And Donna, just lastly, we have less than a minute left, but I do want to ask you, where can the community go if they want to help out with this cause?
Please go. The best thing to do is to go to our website, which is lazarex.org, and it's Lazarex.org. And on our website is all of the information regarding the services that we provide to cancer patients, their families, caregivers, and the community.
Donna, thank you so much for joining us today.
Thank you.
Again, for more information, you can visit their website at lazarex.org. Don't go anywhere. We'll be back with more open right after this.